Hi, my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm going to talk to you about how you can use diet to help heal your thyroid. So I've been practicing over 30 years now. I've seen over 100,000 patient visits. And so many of our patients come in with thyroid issues, thyroid nodules, goiter, Hashimoto's, which is an autoimmune condition. Some have hyperthyroidism or Graves. And the most common thread I see amongst all of our thyroid patients, autoimmune patients, or other patients that have just other chronic health issues, fatigue, pain, headaches, anxiety, depression. Almost all of our patients have one thing in common, and that is digestive issues. We're going to talk about how the two are related and how you can help use diet to clear up some of your thyroid issues and really start to get better. So I had some prior videos. You may have seen the video I did on prior two ones on thyroid nodules and talked about the FreeDiet, which is a diet that I came up with to help with not only this, but other chronic health issues. So we're going to talk about the main four causes of thyroid conditions, nodules, Hashimoto's. So we have basically deficiencies, toxins, pathogens such as viruses, yeast, bacteria, parasites, and food reactions. So the FreeDiet I put out, and I'm going to give you a copy at the bottom. If you feel free to click on that, I'm going to put that on the link there. So sometimes it's just food sensitivities that are affecting the thyroid. Oftentimes, it's more than just one thing. As with any of these chronic health issues, autoimmune or other chronic health conditions, usually when patients come in, it's more than just food reactions, although that's a huge part of it. So like when my wife Dawn had her thyroid nodule, you may have seen that video. It was 2.1 centimeters, and within 7 weeks, we were able to shrink that when she had a follow-up ultrasound, by over 50%. And just within the first 2 weeks, however, she noticed it visibly not being there. So just the diet alone and the supplements we started using started to shrink it, and then we started finding out some other things like iodine deficiency, low in iodine, added that in. So anyway, diet, of course, food reactions played a big role. Deficiencies. Another patient, a young girl, came in. I just saw her again this week to go over all the results. And she had all four of those, which is very common. So she was less than 10 years old. So she was very young, 7 to be exact. And she had a enlarged thyroid, a goiter, very large. And the typical recommendation for enlarged, for goiters and nodules above a certain size is, well, surgery. However, what I like to do is find what's causing it. What's the underlying root cause? It's, you were normal before at a certain point. Now, why all of a sudden it just doesn't come out of nowhere? So, like in her case, so she had deficiencies, iodine being one, vitamin D, iron. Those are all commonly related. Selenium's another common one for thyroid issues. So she had toxins, which was high in some heavy metals. 3, she had pathogens. So she had yeast overgrowth, bacteria, as well as a parasite in her intestines. So that was the blastocystis hominis, which is very commonly related to thyroid issues, Hashimoto's, autoimmune, nodules. And lastly, food sensitivity. So she was highly sensitive to gluten, and she had leaky gut. So all of these together can result in this enlarged thyroid, it can definitely have an impact. And she had has Hashimoto's, very elevated antibodies. So what we do is not only we address all these different things, and a part of that, the food sensitivity part of that, is the free diet. The free diet, it's not only free of gluten, which is the most common food that's involved with Hashimoto's or thyroid issues, nodules, etc. Again, it's not only free of gluten, but free of gluten, grains, sugar, yeast, soy, legumes, corn. These are all, and dairy. So we're avoiding the most common inflammatory foods. So when you want to calm down the inflammation, help the gut heal, calm down the inflammation in the body, which autoimmune conditions and nodules, for instance, are basically an inflammatory response. So we want the gut to heal, calm down the leaky gut, improve absorption, eliminate those inflammatory, food reactions, allow everything to calm down. And then that's why we can start seeing a lot of these chronic issues start to go away. So for some people, that's enough. If it's food reactions or basically causing the Hashimoto's and nodules, that can be enough. I got an email from someone that saw the video, the thyroid nodule video, and she said, let's see, she's in the third week. Tomorrow's my third week of following phase 1 of the free diet. I found it really works for me. My thyroid decreased by size by more than 50%. And now she was asking me some other questions about supplements, etc. So the diet with that, again, addresses the food sensitivity portion of it, and also helps because if you do have yeast, bacteria, parasites, they love sugar, yeast, grains, starches. So what you want to do by following this is it helps to basically starve them. It makes the environment unfriendly to them. And so that's second benefit. And thirdly, with leaky gut, as you follow, this diet can be very helpful for that too. Again, because you're eliminating those very irritating inflammatory foods, which basically cause leaky gut. So, like I said, other avenues besides the diet are that you can also look into is just getting tested for some of the pathogens we talked about. We use a comprehensive stool analysis to accomplish that. As far as deficiencies, you want to get specific blood tests to see what's going on there. Iodine is a big one, selenium, vitamin D, all those are often involved with Hashimoto's, thyroid nodules. And you can test for toxins as well to see how that is involved. And food sensitivities, there's lab testing for, we often do for food sensitivities and allergies, which are a big component. So the reason why I came up with the free diet, again, because it basically eliminates, out of all the hundreds or actually thousands of patients I've tested over the years, I've seen certain patterns with food reactions. So I've basically eliminated those most common food reactions and put that within phase 1 of the free diet. And then as you get into phase 2, and most people are doing so much better by then, they can start to add back in certain foods one at a time and see, what kind of reaction you have. So that's the whole reasoning behind that. So I hope you benefited, learned some things today. If you have any comments, feel free to leave them below. If you do want a copy of the free diet, just click on the link below and we'd be happy to send that to you. And if you want to get early notifications of new videos, feel free to subscribe to my YouTube channel. So thanks so much for joining me today, and look forward to seeing you next time. Take care.